Now moving on to our second section, that is the healing of fractures. As I told you, there are two types of basic healing mechanism. One is the primary healing and the other is secondary healing. And in this section, we'll be briefly discussing all these two basic types. What is primary healing? If you see this diagram, although it's not showing the primary healing, it's showing the secondary healing. But what actually happens is, if this is a long bone, there is actually the blood supply of the such is that there is periosteal blood supply, that actually the periosteum is supplying with the blood to the bone, and there is endosteal supply. Fracture results in disruption of this endosteal as well as periosteal supply. But if periosteal remains intact, then there will be definitely bleeding and leading to hematoma and granulation tissue formation. What this hematoma initially is actually the stage which is very painful. There is a lot of swelling, and the movement of the bones actually leads to quite a lot of pain and is not practically possible. But what happens is, as this hematoma is actually provides a kind of a bed for the callus formation. From this leads to the cartilaginous callus formation, which could be initially soft and then the hard callus. Now initially it was a bone. From this onward it went into a cartilaginous callus form, which is a cartilage. This cartilage later on gets reconverted back into the bone, into bony callus, and eventually remodels, which may take over 6 months to a year, maybe 2 years at times. Usually at times, for example, if it is a femur fracture, remodeling may go on up to 1.5 years, maybe at 2 years at times. So we had to understand the bone formation has occurred usually at 4 weeks to 6 weeks, but once the remodeling starts, it can keep on going up to 1.5, maybe up to 2 years at times. So fracture healing is characterized by a process of new bone formation with fusion of bone fragments. Healing is either primary or secondary. So what is primary bone healing? Primary bone healing, it was a bone which got fractured. In the process of healing, a new bone was formed. This is primary. In case of secondary, what happens is a bone got fractured. Initially, there was a scaffold, a cartilaginous structure was formed, and then cartilaginous structure was secondarily converted into bone. This is actually a form of a secondary healing. So what happens in the primary bone healing? It's a fully stable fracture site, no stimulus for callus. There is osteoblastic new bone formation. Osteoblasts always lay down the new bone. So it's called as contact healing when the exposed fracture surfaces are in intimate contact. When this can happen, for example, we had a fracture, let's say of radius ulna, or for even of a tibia it matters, and some kind of a plate was applied, which could be in form of a dynamic compression plate. In this, the both ends were well united, they were very close to each other, and integrity and of the bone was such that there was closed apposition of the both ends. So in this kind of a structure, and both the bone ends are near and there is a contact between the two ends of the bone which were fractured, this results in a primary type of a bone healing. This internal bridging may occur, but without any intermediate stage, that is, there is no callus formation in it. The bone is not first converted into a cartilage, then cartilage is reconverted back secondarily into bone. In the case of a primary, a bone is fractured, it heals into another bone. Now continuing with the primary bone healing, there is also called as a mechanism called as gap healing. If you see it over here, now this is the two ends of the bone which got fractured. This is where the dynamic compression plate has been placed in, and if you see over here, the contact healing is occurred. The both ends are well in contact. Sometimes other cortex may be comminuted and there may be small gaps which may be present as well. Usually these gaps are invaded by new capillaries from the periosteum. This end when blood comes in, there comes in the osteoprogenitor cells. These osteoprogenitor cells grow in from the edges, eventually forming osteoblast, which lay down the new bone. And new bone is actually placed over the exposed surface, is over this side of the surface. If you see it over here in the diagram big, there is an osteoblast proliferating into this gap area and eventually laying extra bone or new bone over this area. So there was previously a bone fracture. In these crevices which was present in the bone, new bone was actually formation takes place and new bone is actually laid down over this area. If you see again this diagram, this is a fracture line and this is the old lamellar cortical bone. new lamellar bone is being formed over the top of it by the osteoblast, and then osteoclast form they form cone, cutting cone mechanisms are actually present, which actually helps to smooth out the surface so that the uniformly the bone is actually laid over the whole surface of the area. So the crevices usually as the bone are in contact, but there is definitely some amount of gap which is very small and almost less than 200 microns. Usually osteogenesis produced by the osteoblast produce lamellar bone, and wider gaps are filled first with the woven bone, which is remodeled into lamellar bone. But the important point is whether it's woven bone or lamellar bone, they both are forms of bones. There is no cartilage production or cartilage matrix production in case of primary healing. By 3 to 4 weeks, the fracture is actually converted into a lamellar solid area, in which the osteoclastic cutting cones actually then are produced. Why? Because they need to smoothing of the surfaces at the fracture site, and it's such that there's uniformity by the osteoblast when they are laying down the bone. This leads to usually when there is a rigid metal fixation. For example, in case of dynamic compression plate, so this is what happens is where there is a rigid fraction, this bone healing occurs by primary mechanisms. But if there is relatively stable, in which there is some degree of movement, then there is another form of bone healing occurs is called as secondary healing. Now, what is secondary healing? It ensures mechanical strength. As I told you, there will be definitely hematoma formation, but both ends of the bone will not be together in a very rigid fixation. Usually surgical stabilization is not always necessary, but there is a relative surgical stabilization. For example, if there was a femur fracture and a tibia fracture and an interlocking nail was passed. Now, interlocking nail means this military cavity is inside the military cavity. Therefore, some degree of rotation can be may be possible. Some degree of translation and opposition may be possible. So, relative to a dynamic compression plate, this is relatively less rigid fixation. So, what happens is when there is a less rigid fixation, some degree of movement and bone movement can take place between the both ends. This leads to secondary bone formation. That is, there is hematoma formation, then there is hematoma eventually results in formation of soft callus, which is cartilaginous. This callus is then converted to bony callus or a hard callus. Eventually over that the bone is laid down, eventually leading to remodeling. So this is common in tubular bones. For example, in case of femur or tibia, initially, as I told you, there is hematoma formation. This leads to inflammation, then the osteoprogenitor cells, osteoblasts invade the area. Eventually, the soft callus, which is cartilaginous, is produced. This soft callus is converted into hard bony callus, and over hard bony callus, once the bone is formed, then the remodeling phase of the bone starts, so that the eventual strength before the fracture was achieved, which may take up to maybe a year and a half. To eventually the remodeling process continues, and by that eventually after 1.5 years probably the strength of that bone which is remodeled over time is equal to that type of strength of the bone which was pre-fracture level. In this section we have briefly gone through the two different types of healing. When we have a rigid fixation and both ends are together, this results in a primary bone healing, that is, a bone is formed from fractured bone leads to new bone formation in form of woven or lamellar bone. But if there is relative stability, for example, in case of interlocking nail, there is some degree of a movement which is possible at the fracture site. This leads to secondary bone healing. That is, first the bone is converted into form of soft callus or cartilaginous structure, which is then converted into hard bony callus when it is remodeled over a period of time. Thank you very much. Keep watching sqadia.com.